Just let everyone know we will be recording it and will be sent out at the end of the advisory. So we'll be able to send everything out. You'll see it all on Monday, hopefully, if everything goes correctly. Awesome. Well, I think we can go ahead and get started. We have a majority of the folks already trickled in. Um, as we get started, if we want to start by introducing ourselves into the chat, we're just so happy everyone made time for this today. So if you want to introduce your name and your title into the chat, and if you feel like it, maybe share a quick thought on what's on your mind in relation to administrative healthcare, and what you're seeing these days. We're excited to hear everyone's thoughts as we get going, and we can move on to the next slide. Awesome. So we're just going to do some housekeeping before we get started. We do love to see all of your bright and shiny faces. We're all about keeping our cameras on. It is optional, but it does lead to a better conversation that we find. We do ask that everybody stay on mute unless asked to ask a question. Many times when we get to the end of one of our presentations, we'll open it up for Q&A. You can either type it out into the chat or maybe come off mute and have that conversation. Again, we love the chat. So anything, any thoughts, any comments, go ahead and drop that in. This meeting will be recorded. You heard that start at the beginning of this. And the bathrooms are not located. Well, they might be. I don't know where the bathrooms are for you. That is a leftover from an in-person deck, but I hope the bathrooms are just outside to the event space for you all as well. And with that, I can move forward and maybe officially introduce myself, which I should have done at the beginning. But hi, everybody. My name is Liz Kilkenny. I am a project coordinator for Valley Vision. I have been in process with Caitlin and helping plan this event. We've been really excited to focus on the administrative side of healthcare. Frequently, we will host these on maybe the patient serving side, and without the administration, none of that would happen. We need somebody to help schedule and to help bill. So we're excited to be shining a little bit of light on that. And with that, I can hand it over to Caitlin, our project manager.
Awesome, everyone. Nice to meet you all. My name is Caitlin Blockus. I'm a senior project manager over workforce development here at Valley Vision. I'll be our general facilitator here today, but don't worry, you'll see more of Liz a little bit later on facilitating our panel. Before we get started, I want to move to our next slide here and just introduce Alina Anberg, who is a key partner in planning this advisory. And just before I do that, I just want to say thank you to everyone who's joined us here today. I also know that we have a local high school, Grace Valley Christian Academy High School, and Ashley Lewis, some high school students facilitating that. So I know we have a broad spectrum of high school students, workforce development partners, community colleges, et cetera, on this call. So just want to thank you for taking the time to join us. But I'll pass it over to Alina to give a little welcome and introduction.
Thank you. As mentioned, my name is Alina Anberg, Director of Employer Partnership for our North Far North Regional Consortium. So that includes all campuses of Los Rios, Woodland, Yuba Lake, Sutter, Sierra College, and South Lake Tahoe. And then my sectors then are business and technology. So we have some cross-sector going on with the administrative side of healthcare, which is how we're here today. And I look forward to hearing from our employers on what's going on, what's trending out there, and some of the ICT that might overlap with that. Thank you.
Wonderful. Thank you, Alina. Next slide, please. Awesome. Well, I want to walk us through a little agenda here. You're here with our team for a little bit of that welcome and introduction. We have a brief program highlight from one of our members at Folsom Lake College on the new Rancho Cordova Center. We're hoping that they might be able to join us, but if not, I'll share a little bit more on that. We'll also go over some labor market data from the wonderful Anna Hohenreeder we have on here today. We also will have an employer panel discussion, and we'll wrap up at about 2:50, although I suspect we'll get you folks out of here a little bit early. We like to do that, get you on with your Friday afternoon. So that's our agenda here today. And I'll move to our next slide. I just want to say a quick thank you to our sponsors. These advisories are funded by the Los Rios Community College District. For folks who may not know, we host 7 or more regional industry advisories in the fall and spring of each year, over 7+ sectors. As you know, this is our healthcare and life sciences sector, but our funding from Los Rios, as well as braided funding from the local capital region workforce development boards, helps to make this possible. We also work in tandem with other local community colleges, including Lake Tahoe Community College, Woodland, Yuba, etc. So we really kind of work across the greater Sacramento region, and just want to say a quick thank you to that. And I'll move to our next slide here. I don't know if we have Rose Giordano on the call quite yet. She has a busy day, so I just want to confirm with our team here. But if not, I think we could move right on to our next slide. We wanted to share Folsom Lake College has an extension center and a new center opening up, the Rancho Cordova Center. They have a new instructional healthcare hub. It doesn't specifically focus on administrative healthcare roles. These are a lot more clinical positions, but really exciting because in some of these past advisories, we've focused on the key areas that the center is focusing on, including surge tech and rad tech positions, cardiovascular, and other roles. So really exciting to see this space open up in our region. They are having their grand opening on April 29th. So there's a little QR code here to scan if you're interested in attending, but wanted to call that out for y'all before we dive right into things. So I'll keep plugging along here and pass it over to Anna, Anna Hohenrieder, who's a research analyst at the Centers of Excellence for Labor Market Research. And I will give it away to Anna to dig a little bit deeper into that labor market data. Thank you so much, Anna.
I think everyone should be able to hopefully see these on the screen. So as mentioned, my name is Anna Hohenrieder. I'm a research analyst with the Far North Center of Excellence for Labor Market Research, and will be providing the labor market overview for administrative healthcare. Let's see here. Just a little bit for the agenda. I'll start off with a little bit about COE, go over the general health sector highlights, highlight a few top occupations, go through the job postings analysis, talk about some aligned post-secondary educational training, and wrap it up with a conclusion and some further resources. And we should have a good amount of time for some other questions at that point too. So first, a little bit about the Centers for Excellence for Labor Market Research. It is the labor market research partner for the California community colleges, and it operates statewide, but we also focus specifically on regional labor markets. So the data you see today will pertain specifically to the greater Sacramento's labor market, and that covers the 7-county region of Yolo, Yuba, Sutter, Placer, Nevada, El Dorado, and Sacramento counties. And then going into our research focus, we look at data from a variety of sources, including industries, occupations, wages, skills, credentials, and employers, to answer practical questions like which jobs pay a living wage, what's the general job outlook, what skills and credentials are needed, and other questions. And the data is routinely used to invest in new and relevant programs at the community colleges, and to support other grant applications by showing an understanding of regional labor market demand. So today's goal is to connect this regional labor market information to program planning, workforce pipelines, and student opportunities as it relates to administrative roles within the health sector. So I'll start by going over the health sector as a whole. We can see here that there was 140,000 jobs roughly in 2024 within Greater Sacramento, and that's projected to grow by about 11% to 155,000 jobs by 2029. So it is one of the largest and fastest growing sectors within Greater Sacramento. It does comprise about 11% of all the Greater Sacramento jobs, and with about 6,000 establishments. And we can see here on this next slide that with the exception of a small dip in 2020, there's been long-term consistent job growth in the health sector. So we're seeing strong consistency that the health sector continues to grow and remain stable, even through various economic shifts. And then we can see on this slide the different subsectors at a high level for the health sector. So the largest share of jobs sits in ambulatory care, followed by hospitals and nursing care. And ambulatory care includes a variety of things. It includes physicians, dentists, mental health providers, HMO medical centers, dialysis clinics, ambulance services, and any other outpatient care services. And ambulatory care, it's also driving growth for the sector as the growing aging population is putting more pressure for outpatient care across the nation. And as we look at the sector employment, you can see here on this chart the different categories of occupations that are employed within the health sector. Now, as we would expect, many of the health sector occupations are focused on direct patient care. So those health practitioners and technical occupations that would include nurses and doctors, and also those healthcare support occupations includes those technical level roles like a dental assistant or an occupational therapy technician, those types of technician level direct patient care roles. But we start to see some of the administrative roles in office and administrative support occupations, in management occupations, in business and financial operations occupations, and in computer and mathematical occupations. And there are some administrative roles in the all other occupations, but those occupations are generally roles that are not focused on direct patient care or administrative tasks like facilities or construction or legal services. So in looking at all the health administrative jobs, we can see here those divided by skill level, and you can see that most of the administrative jobs within healthcare are middle skill. So we define middle skill jobs as jobs that require a little bit more education than a high school diploma and a little bit less than a bachelor's degree. So most of those occupations are currently middle skill. And those occupations include quite a few different occupations existing in a variety of industries. So it includes receptionists or accounting clerks, as well as other administrative roles you'll see in a variety of industries. But for the top occupations, I wanted to focus specifically on some roles that you'll just see within the health sector. So we can see that here in these top occupations. The first occupation listed is not actually a middle skill occupation. That is considered an above middle skill occupation, medical and health services managers. I did mention it because it is the largest occupation in terms of job numbers, with almost 5,000 jobs and over 500 annual openings projected. And it also has some of the highest growth, so almost 20% growth expected by 2029. To give you an idea, the average growth for the region for all jobs is expected to be about 6%. So we are seeing that one increasing quite readily. And also many workers currently in other middle skill administrative roles may aspire to that medical and health services manager role. But looking at specifically the middle skill roles, we can see medical records specialists, health information technologists and medical registrars, and medical secretaries and administrative assistants. All of these roles are also outpacing the general growth for the region, and all of them have quite a few annual openings as well. You'll then see on this next slide that the wages for all these occupations are quite strong. So of course, very strong wages for medical and health services managers, but we also see that all the middle skill occupations have wages that do exceed the living wage for a single working adult, which is $21.19 per hour in Greater Sacramento. So all of those have entry-level wages exceeding that living wage for a single working adult. And then the health information technologist and medical registrar specifically has a median wage that exceeds the living wage for a working family, which is set at $42.55, which suggests that, especially for that occupation, there is quite a bit of potential wage growth for an opportunity for more senior roles within health information technology and medical registrars. And now I'll go into a little bit more with the job posting analysis. So when looking at the job posting analysis, I was looking at all of the jobs coded to the 33 industries for the health sector. And this is looking at online job advertisements between April 2025 and March 2026. We know that job posting data is different from labor market information in that it reflects what employers are asking for right now. And we share this job posting data because it helps to catch emerging skills or changes in hiring activity. But we also acknowledge some limitations to job postings. We know that not all jobs are posted online, and that some postings are duplicates, some postings are never filled, some postings hire multiple individuals per posting. So the job posting and hiring volume doesn't always match workforce size. But together with the previous labor market information, it'll give us a more full picture of what's happening in the labor market. So we can see here the overview of job postings. So there was about 30,000 job postings in all of health, with about 6,800 administrative postings and about 2,369 middle skill administrative postings. So those were further filtered down to include just the middle skill administrative postings. And you can see here the top middle skill occupations by number of postings. So we do see some middle skill occupations that appear in a variety of industries like receptionists and information clerks, but we also do see some of those specific occupations I mentioned earlier, like medical secretaries and administrative assistants and medical record specialists. I'll give it a minute to look at that. And then here on the next slide, I've listed the top 10 companies posting and the top industries. So we can see the top company was UC Davis Health, followed by a variety of other health systems and also some residential care towards the bottom. And then for these industries, I listed the detailed industry here, but how this relates to the previous slide with the overall industries, all of these industries listed with the exception of the first one, medical and surgical hospitals, as well as with the exception of assisted living facilities and nursing care, all the rest of those listed here are part of ambulatory care. So we are seeing a similar breakdown for industries for the administrative healthcare relative to the total number of jobs in those industries, with about 55% of the postings in ambulatory care, 30% in hospitals, 14% in nursing care, and 1% in drug sundries. And then I know that there's a lot of information on this slide. I broke down the administrative middle skill job postings by their general functions and overall job function area, similar to how the composition was shown earlier within the health sector. So we have business and financial operations, computer and mathematical occupations, office and administrative support, technical records occupations, which just includes two specific occupations, the medical registrars and the health information technology occupations, and the management occupations. And as far as how these were spread without the job postings, we saw 8% of job postings in business and finance, 3% in computers, 67 by far the most in office and administrative support, 11% in technical records, and 9% in management occupations. So you can see here the top 10 specialized skills listed for each of those functional areas of occupations. And there's quite a few specifics for each group, but there were some overall trends. We can see those highlighted here. Many of them mentioned auditing as a general skill, as well as billing and workflow management. And those specifically were all listed for office and administrative support, as well as for management occupations, which suggests that those skills are particularly useful across various administrative roles and potentially for higher level management roles. And now looking across all of the middle skill administrative postings, I've listed here some of the transferable or soft skills that were mentioned most often. By far, we were seeing communication mentioned. It was referenced in over half of the job postings, very commonly requested. That was followed by customer service, scheduling, management, operations, detail-orientedness, multitasking, and organizational skills. And in particular, scheduling, multitasking, and interpersonal occupations were flagged by Lightcast, which aggregates these job postings, as being posted more frequently today in job postings relative to a couple of years ago, which suggests that those skills are on the rise. And next, I'll go into some of the top software skills as well as some related certifications by job. You can see, again, a lot of information on this slide. Microsoft Excel, by far the most commonly requested software. So Microsoft Office, Microsoft Excel, Outlook, Word, PowerPoint, everything in the Microsoft Office suite was by far the most commonly requested across any administrative functional area. We also do see productivity software appearing quite often, as well as Epic EMR. That was by far the most common medical records system. And you can also see in some of these lists that certifications for basic life support were requested, or CPR or first aid. So even if these roles didn't have direct patient care, having some general medical training was often requested amongst employers. And then I did want to spend a little more time specifically looking at the certifications requested for computer and mathematical occupations. We can see that a CompTIA certification was mentioned quite frequently. So those were mentioned about 15% of job postings, with A plus being most commonly requested, followed by Network plus. And then I wanted to spend more time on the technical record occupations. Again, that just covers two occupations, which is the medical record specialist and the health information technology and medical registrars occupation. And we can see that many certifications were requested. Most of these certifications came from the American Health Information Management Association, AHIMA. So that includes the first one, the Certified Coding Specialist, which was present in 26% of postings, followed by the Registered Health Information Technician, which was in 25%, and the Registered Health Information Administrator, which is in 24%. And then there were a few other postings for other certifications by other agencies, including the American Academy of Professional Coders for this last certification for clinical documentation specialist. And then on the next slide, I wanted to go specifically into the employee preferred education experience for those top occupations mentioned earlier. So we see here for those top middle skill occupations, most of the job postings for medical secretaries and administrative assistants did not list a minimum level of education, or if they did, they requested just a high school diploma or GED. We do see that, though, for the medical record specialists, most commonly a high school diploma was requested, but there also were quite a few employers that requested an associate's degree or a bachelor's degree. And for health information technology and medical registrars, again, most requested was a high school diploma or GED, but quite a few employers also requested an associate's degree. And then looking at the experience level, we can see for medical secretaries and health information technology, most of those did not list a minimum experience level, but medical record specialists on average requested a little bit more experience. So usually at least 1 year of experience for that role. And then with that, I wanted to pivot to another hot topic within administrative healthcare, which is how AI potentially could impact healthcare. So with that, I'll leave it to the employer panel to talk more specifically about how AI is being implemented within these health spaces. But we do know generally that while most clinical roles are very safe for replacement, that's not necessarily the case for the administrative roles. We do see that AI is leading to the automation of many administrative tasks, especially in those in customarily entry-level roles. And just as a case study, we do see specifically for the occupation of medical transcriptionists, which I haven't mentioned yet, but medical transcriptionists or medical scribes, those jobs are down over the last 5 years. They have declined by over 35% in the last 5 years in the greater Sacramento region, and flat growth is currently projected. So there are some occupations that we are seeing fewer jobs being posted or more automation of AI. And we also see that many other middle skill occupations are highly exposed to AI. So you can see here on this chart, this comes from the Stanford Digital Economy Lab. And this looked at nationwide all industries, looking at occupations that are most exposed to least exposed to AI. So most exposed being most commonly having AI currently doing those types of tasks. We can see that relative to the 2022 job numbers, the most exposed occupations had fewer total job counts as of 2025, whereas the least exposed had job growth from 22 to 25. And across all occupations, it was generally flat growth to a slightly positive growth. So and we also do know that some parts of these administrative roles still are very resilient to having potential automation or replacement by AI. So there still is a high degree of value for those with personal interactions. So those directly interacting with clients or those managing teams. Also those with high institutional knowledge, which is why early career professionals will often be most impacted by the implementation of AI. And also when roles where accuracy and quality are paramount, there's probably going to be a person required to do the final checks for those types of roles. But we also do see that AI could augment other occupations, and it could lead to more demand for those in technical roles like health information technology workers or those in cybersecurity. So with all of that, I'll transition to the current community college programs and supply. We can see here the active community college programs within the greater Sacramento region, and there are quite a few. At American River, there is healthcare interpreting. At Cosumnes River, there's the most, which has health information coding specialist, health information technology, medical assisting administrative, medical assisting medical insurance billing, and then at Lake Tahoe, medical office assistant, Sacramento City, healthcare business, and Woodland, medical office specialist. And then here you can see the supply of the awards, the average supply of awards over the last 3 years. So we see administrative medical assisting an average of 17 awards, health information technology 22, health information coding 4, health care interpreting 12, and medical office technology 3. Now, in looking specifically at that health information technology and that health information coding, those two programs are highly aligned to preparing students for those medical records specialists and the health information technology roles. And just to remind everyone, there's 128 projected annual openings for medical records specialists and 22 for health information technology roles specifically. So we do see quite a gap for the preparation for those specific roles, but that gap is shortened some by the awards from private institutions. There are another 77 awards coming from private institutions preparing students for those roles. And then for administrative medical assisting, it's hard to say what the gap is specifically because, as mentioned, most employers do not necessarily require more education besides a high school diploma. But these types of programs could be very valuable if they focus on soft skill development or help students with preparation for the skills mentioned earlier, like teaching them productivity software or medical record systems. And then healthcare interpreting it's also hard to estimate the exact supply-demand gap. But we do note that for all interpreters, there's about 69 annual openings, but that in turn includes interpretation in all fields. So in legal fields and education, as well as medical interpreting. But we do know that interpreting is very vital to the region, and that in general, the greater Sacramento region does have more people with English as a second language than the national average. So this is a very highly valuable program to the region. And with that, I'll go to the conclusion. So in conclusion, we see that the health sector hosts a significant number of administrative jobs with also strong growth potential. And we do see that a majority of these new roles will be in ambulatory healthcare, followed by hospitals. Most of the current administrative roles are middle skill, but AI is likely to augment and automate some of those roles. So therefore, instruction training for administrative healthcare should focus on broad administrative skills. So first providing a general understanding of the health field, making sure students understand medical terminology, regulations, billing, how the general medical system operates, and potentially encouraging them to gain some extra certifications in baseline medical knowledge, like a first aid certification, could help greatly. And then, of course, Microsoft Office, ensuring that students are well versed in that, especially Excel. Productivity software and general familiarity with AI and other AI tools could also be highly valuable in many administrative roles. And teaching students electronic health record systems, especially Epic EMR. And lastly, focusing on some of those soft skills. So communication and customer service skills, still highly valuable within the administrative skills, often sometimes more valuable today than they might have been in the past. And programs training specifically for those medical record specialists or those health information technologists and medical registrars should prepare students for some of those common certifications. I'd forgotten to mention it earlier, but all the job postings that had mentioned having a specific certification, like the CCS or the RHIT certification, all of those job postings had higher advertised median salaries than those that did not. So there is real value in preparing students for those specific certifications. So with that, I'll wrap it up. Here I wanted to show everyone some related resources. There's of course our priority jobs and programs report, which talks about some other priority jobs related to various fields and the general supply of awards across multiple sectors. And then also we did just recently release our sector profiles for Greater Sacramento and for the Far North. So you can see specifically there that health sector profile, which talks more about some other top occupations within the health sector. And of course, you can always see those on our website, and you are welcome to contact me. And then also when you get this presentation, you'll see at the end, we have some general data sources as well as some further resources for more information about some of the specific studies referenced here, as well as some potential future learning about how AI is affecting jobs within this space. And with that, I'll turn it over for questions. I know there's been quite a few
Yeah, I can
messages in the
uplift.
chat.
I think the first one, Anna, from Daniel Wu. Is there any data about what hiring managers say are the top reasons job seekers to key roles get rejected or hired? Curious on how that could guide workforce training. Quote, most desired or requested could potentially mean basic requirements. Could you talk more on that?
Yeah, I would say that. So as far as the data that we have access to with the job posting analysis, Lightcast looks at a variety of online job postings across various online job boards. So with that, with each job posting, we don't necessarily know if someone was hired, who was hired, which people were hired, how many people were hired. So it is in some ways a limited view. I would say that to really answer that question, we would have to look more specifically with the employers, but I know that could be a good question also for the employer panel, which is coming up, on what they're seeing as far as how prepared people are for these roles and who's being chosen for these roles.
Thank you so much. And I see a comment too from Susan on the healthcare workforce initiative. Did you want to maybe speak a little bit more about that, Susan? I know I'm curious. I'd love to hear more if I can put you on the spot for a second.
Sure, not at all. I think you remember me from last time. I love to talk, ask
Yeah, I love
questions.
it. I love it.
No, so personally addressing the professionalism or soft skills, Anna said, yeah, sometimes that's even more important. I've been on just about every kind of advisory board on both sides, the academia side and the provider manager side. And this is something that I see at all the community colleges and even at the university I currently work for and here in Arizona. Um, this is something that's lacking in any part of the healthcare field. So the Health Workforce Initiative, which I put the link in there, HWI, they literally have under their curriculum the high touch healthcare, the critical six soft skills. And they do a lot of our funding. So, when we want funding, we need to obviously work with them to see what the national and state boards are looking for um, in our healthcare, allied healthcare, nursing, any kind of fields really that we need to have. So this is just a great resource for those soft skills when you're considering any kind of administrative or any kind of healthcare program, really. It's something that even I see is still as a working nurse per diems. People are really lacking when they're coming out of programs with these schools that don't address these soft skills.
Thank you so much.
My pleasure.
And one other question in the chat, do we have a sense for which of the roles you mentioned most persistently go unfilled? I wonder if that could be a way to prioritize which roles to target for various workforce programs.
Yeah, I wasn't able to see anything that rose up to the top as far as roles that were commonly unfilled. I think part of it is that it's difficult that we're looking at so many different administrative roles.
Hmm.
And I know that there's probably different needs for different employers as well. So I think that could also potentially be a good question for the panel. But there wasn't anything that really rose to the top for this one, like there was for the legal services, where there was persistently a lack of available people for certain roles.
Thank you so much. And I actually have a question for you, Anna. And I'm thinking of,
Mhm.
I know we have a high school classroom who's tuned into the call, and maybe this is a little bit of a recap of what you mentioned previously. But if you're a high school student and you're considering going into one of, this career path after college, are there certain occupations that you would recommend from what you've shared?
I would say that as if you're thinking specifically administrative healthcare, I think there's a lot of opportunities. Certainly the ones that I'll mention first, I'll go back to this slide, would be some of these top occupations. In particular, the health information technology or the medical record specialist. Like if you have a specific interest in potentially IT or like other spaces like that and healthcare, that could be a great way to combine those two. But also there's still great growth potential for like roles in finance or various other administrative roles. So I would say there's a lot of different potential pathways within administrative healthcare. It really depends on the specific interests. And these medical and health services managers, they exist across all sorts of administrative roles. So there's those types of managers of specifically the clinical staff. There's those managers of other medical record specialists. There's lots of different potential management occupations and paths towards management.
Thank you so much. Yeah, that's super interesting. And to give a little bit of a background too, our team has hosted these advisories on a variety of different medical related occupations, but we've never delved into this administrative side. And as we see this growth of overall healthcare facilities or healthcare in general in our region, these are the folks behind the scene making all this happen. I know for myself, if you drive along Highway 50 nowadays, you'll see UC Davis Health's new building on the side of the freeway. So Sutter Hospital, Marshall is expanding as well. So these are those kind of backbone positions that make these hospitals run. Thank you, Anna. Any other questions from folks or questions from our team too?
I want to allow questions from our audience, but I did have a question. As I was looking through the slide deck yesterday, and as we've gotten them in advance, I was looking through and I saw on top 10 software skills and certifications, not to make you click through the deck more, Anna,
Gotcha.
but I was wondering if you could expand on what some of those productivity softwares that you were seeing
Mhm.
were.
Yeah, so that would so it did list it broadly as productivity software. I believe that that things like Asana or other type or like Workday or like any type of those types of softwares were included in the productivity software. So I don't know if there was a specific one mentioned. I think generally understanding like how to do online tasking, how to organize like automatic calendaring, those types of general applications of productivity software would be most useful.
Awesome. Thank you so much. And again, opening it up to all of our audience if there's any other questions.
Yeah, a lot of similar to project management software.
Oh, awesome. I see some folks chiming in the chat. Workday as an example.
Mhm.
Awesome. Any other final questions for Anna while we have her?
Other data. Oh, yeah. I see another question. It's just coming there. Let's go to that slide.
Thank you.
Mm-hmm. Yeah, I think Daniel asked a good question there about which roles are most likely to be harmed by automation. Certainly, as mentioned by others, that medical transcriptionist certainly comes to mind as far as replacement of if doctors are using an AI scribe, will they need as many medical transcriptionists? That is certainly a concern for that role. But we do see generally across all roles that early career entry level roles more impacted than some of these senior level roles. And that as far as the data here shows that those that are more exposed to AI, the report itself here is listed, and you can see that also on the resources. And it goes into more about like what is more exposed and various definitions of how they arrive to what is most exposed. But we do see quite a few roles with administrative focused tasks, and those roles generally do have lower headcounts. So, and yeah, and then also, as I think someone mentioned, billing as well. There's definitely is look they are looking into if there could be AI specifically in billing, and there's also another reference in the resources of how that could impact the billing system. And it doesn't sound like we're there yet with the different regulations, but how that potentially could appear in the next few years.
Thank you. Susan?
Questions from me again? Yes. So, in the last advisory meeting I was with you folks, I talked a lot about funding. So, as we see if on the slide where we were showing what community colleges are actually having these administrative healthcare positions, and obviously Consummate's looking really strong there. Where is the additional funding coming to expand on these, especially AI specific, technology specific admin roles coming from? And how do we get community buy-in and partnership to increase that funding for schools that don't have a direct administrative? Most of the time right now, it's MA plus admin. There's never really that focus on just the management or just even just the billing. So just curious about funding and partnership and community buy-in.
Yeah.
Yeah, I can't speak as much to the funding in particular, but I know places like Folsom Lake, it's not listed here, but they have a real focus on AI in general. And I think that's part of it is that even though not all the programs are necessarily going to be focused on healthcare, but having some general skills in AI, it might come from a more general focus. It might be other types of IT focused programs, but that still could be very valuable in a healthcare space. And oftentimes those people will still work potentially in the healthcare space.
And I'll note too, that's something that we focus on at Valley Vision even before AI. We focus a lot on automation risk and what that has and the impact of that on jobs in our region. and we'll be continuing to do that. We have even plugged into our panel questions coming up here, a question around AI and what employers are seeing. So, in the future too, as some of those things arise, please feel free to reach out to our team and we'll do the best that we can to get you information, whether that's labor market data or connecting with community college folks. We're here as a connector. We may not always have that information off the top of our heads, but we'll dig into it and find it for y'all. That's what we're here to do. Thank you. Good question. And I think one or two last questions here, and then we'll wrap up. But question from Ashley Lewis. I'm curious if productivity software or billing systems like Epic are included in the curriculum at the community college programs, or these skills that applicants can get on their own through specific courses. And I don't know, Anna, if you have the data on that, you might, or if there are community college folks in the audience. I see Alina responded. If you do have some of the Microsoft programs, but not Epic specifically.
Mhm. Yeah, I appreciate Alina's response to that. I know that the curriculum for each of those programs is mentioned generally on those websites. I didn't look specifically at the different courses. You'd probably also have to look specifically with the instructors of if particular systems were taught in those. So I don't have information on that, unfortunately.
No worries. I think we have one last question for Anna from everyone. And thanks, Anna, for your patience. Anna has been providing our labor market data across our advisories, so we've worked really closely with her this spring. But if there's any remaining questions, folks can go ahead and drop them in the chat. But just really appreciate you, Anna, taking the time to share this lovely data with us. We're data nerds here at Valley Vision and want to supply that all for you. So really appreciate it. Thank you so much, Anna.
Yeah, thank you, everyone.
And we'll steal back the screen here and go ahead and jump back into our presentation. And we have the lovely Rose Giordano on the call with us here today, Interim Dean of Instruction of the El Dorado and Rancho Cordova Centers at Folsom Lake College. I know I briefly touched on this earlier, but Rose is far more qualified to speak on it. So I'll pass it over to you, Rose, and talk about the grand opening.
Thank you, Caitlin. Apologies for being a little late, and thank you for putting my photo up there too for everyone to look at. So yeah, I don't know if you have the date in front, but I am the dean that oversees the Rancho Cordova Center, or RCC, and on the 29th we do have, when we say grand opening, originally Rancho Cordova Center Education Center was mostly GE courses, and then just recently, a couple years ago, Sutter Health invested $2.5 million into the center, and we renovated the first floor. And that first floor now is really focused on healthcare programs. Specifically, right now we have a certified nursing assistant. We have rad tech starting in the fall, brand new program. Our was that radio technology technician. Why can't I say the words today? Sorry. And also EMT, emergency medical technician. And we're looking to expand our programming from there. Second floor, we still have some GE courses, but we are pushing in some prereq courses so students can do their prereqs and then move right in to some of the healthcare careers that we are locating specifically in Rancho Cordova. We do have other allied health programs like medical lab technology that are at our main campus and our El Dorado campus, but this is something we're really excited about. And it's good to see some of the information that Anna was sharing, because it ties into the folks that were graduating into these career or sort of working elbow to elbow in the same space as the folks that we are putting into the workforce. And the data is just as promising. And so seeing the healthcare technologists, that's something we're thinking of integrating into the healthcare hub too. And we're sniffing around Epic training, right? And knowing that AI is coming, and the folks know that the students we're graduating are going to see it in the workplace. And so the big question is, how do we get them ready for that? And so if folks have some ideas, some maybe some possibilities. I see folks in this meeting that are also from Marshall. We work very closely with Marshall and Kaiser, and UC Davis, and of course Sutter. And so we're open to collaboration. So please join us. I'll be there, of course, 1 to 3. A lot of people already signed up. Lots of folks talking, and we'll have the classroom set up with the faculty there. So if you'd like to join us, please do. Thank you.
Thank you so much, Rose. And I love that working elbow to elbow. That's so accurate and
Yeah.
what we're here to do and plug. Thank you so much. Well, I appreciate that. And yeah, if folks have any questions on that, feel free to drop in the chat. I can snag the link to the direct link for folks who want to go in and register. You can scan that handy dandy QR code. But with that said, we'll jump into our next slide here, and I'll pass it back to Project Coordinator Liz Kilkenny to introduce our wonderful employer panel. Kind of nicely dovetailed in there. Liz, I'll pass it over to you.
Thank you. And just quickly beforehand, we did no worries about Rose because we did punt this to her about 2 days ago, and she said yes and was able to be available and make it happen. So we're just super grateful that she was able to talk to the new program and happy to have you, Rose. So thank you so much. And with that, we can talk about the industry panel discussion that I'm really excited about. We have some really amazing panelists today. We have Sarah Logan from UC David Health. She is the talent acquisition manager. We also have Shannon Yorkovich. She is from Marshall Medical, the director of People's Experience. Elisa Gallagher from Sutter Health. She is a recruiter. And I also have Brandon Brockhouse from California Correctional Health Care Service, community outreach manager. So we're just really excited to have all of our panelists here. We have some questions for them, so I'm gonna jump right into it and maybe start with a quick round of introductions. I'll go ahead and drop the questions in the chat just so everyone can see it and we can refer back to it because sometimes I know it's easy to forget what we were talking about when we have so many people chatting. But to get started, I'll go ahead and call on Sierra just because you're the first one on the screen. Can you tell us a little bit about your organization and your role, along with a quick snapshot of your workforce, who you're hiring, how you're hiring them, and the kinds of roles that you guys are supporting within admin health?
Sure. Good afternoon, everyone. I'm happy to be here. So to get us started, I would say at a high level, our organization is really focused on delivering the right skill for our opportunities. And my role is centered on administrative operations and workforce support, not only for our regular hiring, but any crisis hiring or strikes or any type of huge workforce coming into the organization. I would say a significant portion of our workforce is made up of administrative and non-clinical roles. When I think about administrative roles, this for me also includes frontline staff, patient access representatives, billing specialists, care coordinators, and then different administrative like operational and office support teams. We're actively hiring roles really that just keep our system going. So scheduling, registration, revenue cycle, and coordination roles. Um, how we're hiring, I would say, has evolved quite a bit. We are placing a lot more emphasis on skills, like as mentioned today, customer service skills, digital literacy, scheduling, problem solving, rather than just prior healthcare experience, which used to be our standard. So making some changes in how we look at the talent really for our area as well. And we're also right now looking more closely with training programs, creating community colleges to expand building our entry-level pipelines and upskilling people for the roles that we have. I think I'll stop there so I don't get ahead on questions.
Don't worry, I'll have more for you, Sierra. That's really interesting, the skills over prior health experience. I'm excited to dig into that with you in a little bit. Elisa, I think I'm going to pass it to you because I'm interested to see, as a fellow larger health system, what you have to
Hi,
say.
yeah, thank you. My name is Elisa Gallagher. I'm from Sutter Health. We have about 64,000 employees system-wide and about 16,000 employees in the Sacramento area. We have hospitals throughout the Bay Area, Central Valley. We have a hospital up at Crescent Valley City up near Oregon. And then we also have some outpatient facilities down in Santa Barbara. But we're growing, we're expanding, and um, like Sierra said, we have about 500 positions open right now in the Sacramento area, and a lot of them are for entry level positions. So the front patient service representatives, security guards. Um, that's really important. Supply chain, CNAs. So those are the positions we are for administrative roles. And then credentialing coordinators, administrative coordinators too. So we have a bunch of those positions available. Of course, it's really the patient access care that we're focusing on. So it's really the front line. And then also we have nursing positions and allied health positions too.
Perfect. Thank you. I appreciate that answer. And then Shannon, as a slightly maybe smaller, more nimble hospital system, I'm curious what you guys are experiencing slightly up the hill.
Yeah, thank you. I'm Shannon Yorkovich, the Director of People Experience. So my role is really more of the HR operations pieces of it, as well as overseeing the organizational learning and development teams, and then partnering with talent acquisition and total rewards. We are unique in that we're one of the few rural independent hospitals in the region. So we have about 1,600 employees, continuing to grow, which is great because COVID took us down a little bit. And similar to Elisa and Sierra, we are looking for all sorts of clinical staff. Of course, that's our bread and butter sometimes, but for the operational, administrative, patient-facing support roles, those account for nearly 20% of our job openings right now. And a lot of those are high volume. In addition, a lot of those folks are growing their careers. And so we do hire them very frequently. It's really important for us. We currently don't use AI in our hiring process, so it is still hands-on. We have recruiters talking to candidates, doing those phone screens and getting a feel for those soft skills and those cultural fits as we move them on to interview and hopefully to hire.
Ah, thank you. And it's good to know that you guys aren't using AI. Sometimes those can filter out some people, so that's interesting. Brandon, as not only like the state employer here, but also representing the correctional facility, I'm really interested to see how you might respond to that.
Yeah, so my name is Brandon Brockhouse. I'm the community outreach manager, and the name is a mouthful. It's California Correctional Healthcare Services, but we've shortened it down to CCHCS because the state loves acronyms. In my role, I kind of help lead the statewide recruitment strategy. With that, we have similar to what Shannon was mentioning and some of the others as well. A lot of our clinical roles, so RNs, LVN, CNA, psychiatric technicians. But then we have the administrative support roles, whether it's in HR, some of our health program specialists, records technicians, a lot of our analyst roles that really help within that correctional setting, help support the clinical and mental health staff.
Thank you. I really appreciate that. And I know that it's one of those overlooked industries is the correctional facility. So I really love having you on here. I think I'm going to pick on you just a little bit longer as we transition into that next question. As I know that we didn't see you guys called out as a public sector within the labor market data. So I'm curious if you had anything to share along those lines or if anything surprised you that's wildly different than what you're experiencing at the state level.
No, honestly, I think a lot of the data kind of, held true for us as well. I think what really I don't want to say gets in our way, but what really affects us as a state entity more is kind of like what you were mentioning, Liz, how we are somewhat of an overlooked organization. I think over the last year we've really done a lot to kind of gear up our college outreach. We are an organization that is more welcoming to new grads, but a lot of these, college students don't really take into consideration, working within correctional healthcare. And so over the last year, really trying to, get our name out there and go to some of these different colleges and universities throughout the state, really trying to open up and shed light on what we do because it's not necessarily something that anyone has ever really considered. Um, but with that, we have 31 institutions throughout the state of California. With that, we serve over 100,000 of the adult incarcerated population. And so the healthcare needs are there. And so just trying to do what we can do to generate more incoming talent to be able to support those in need of healthcare.
Yeah, well, we love having you here and being able to uplift this as an opportunity. So frequently, we hear a lot from employers or people looking for jobs. Everyone wants us to have experience. So it's nice to have an employer that's like, I will give the experience.
Absolutely.
Yeah, so thank you so much for that. And then I think I'll do a little bit snake and we'll go backwards. So Shannon, as you're looking at that data, is there anything that's resonating with your experience in the hiring process for these roles? Any gaps that you're seeing?
Yeah, the increased growth in ambulatory care really resonated. That's been on our radar, obviously, as you mentioned, or it might have been Liz, but with the Highway 50 corridor just really beefing up and um, growing, I think, faster than we could pave new roads for it. Has been our focus. We've increased our Eldorado Hills outpatient clinic, Town Center West last year. And similar to what Brandon mentioned, in the last year, we formalized a student program to help with those, whether it's job shadows or internships or whatnot, to help strengthen our pipeline as well. And then the focus on the digital literacy and workflow adaptability has been really large for us lately. So happy to see that in some of the data sets.
What systems are you guys looking for when you're talking about digital literacy?
Well, we do Workday, as I mentioned, which is kind of a beast, and we do use Epic, but I think more importantly is the capability of a candidate to have the confidence to learn a new software system and the confidence to adapt to the change in workflows as those software systems evolve. Absolutely.
Yeah, that makes so much sense. And sometimes it's really hard to remember that undo button and to be wrong and to make that mistake. Thank you so much, Shannon. And Elisa, since we're doing that little snake backwards, I'm curious if there was anything that stood out to you or resonating with you.
Actually, this kind of same thing what Shannon was just saying. The people, the students have the knowledge, but it's just getting that real world experience of what it's like to be in an urgent care hospital patient and being able to not master those skills like Epic and Workday, Microsoft, but just be able to adapt to that and to be able to learn those programs and have that kind of when they're coming in. So exactly those things, and just understanding the workflow when a patient comes in and all that too. We feel like maybe some students need a little bit exposure or just more exposure of that or training or maybe doing some shadowing to see what it all entails.
Yeah, I mean, I've not worked directly in hospital administration, but I imagine it's a different language that you have to learn and a specific way of communication that's really important, especially when we're talking about patients. So thank you for that,
Yes.
Elisa. Sierra, since you guys cover such a wide swath of the region, I'm curious if you guys are experiencing anything
Yeah,
or
I
if
think both
there's.
the presentation and the fellow panel members really resonate with me with what we're seeing, especially for like the workforce strategies and turnover. And I also think for administrative roles, it can show up a little bit differently and the burnout gets overlooked for us.
Mm,
Um, I also see alignment with like challenges around retention and competition for talent. That's always
yeah,
something. Um, but I totally agree that we see the gap in the talent that we bring in and just a willingness to learn all the new technologies, um, to really be able to apply the, excuse me, knowledge and like process changes. We're really big on process improvement at UC Davis across the health system to look at inefficiencies. And so change fatigue can also come in a lot. And I think that lends to the burnout. And the administrative groups are typically the most impacted by like a process or a system change. Um, because our clinical folks are like going in there making a note and getting out or doing an order where we're really facilitating all the background pieces. And we change our technology often. We're looking for a new ATS now, and so I'm really seeing it even like within my own team, some of
yeah.
that burnout. But we got to keep moving forward. I always promise change is the only thing I can promise that we'll see. But getting our new talent to understand that you have to be willing to adapt and change and learn something new. I've recently had to take on some new technologies that I've never seen before, especially around like project management. But we also use Epic. Smartsheet is really big for us for a project management system. And then just a lot of Epic modules like for billing, scheduling, etc. But we use Epic um, for all of that work that gets done, billing to scheduling patients. Yeah.
Nice. And that's so interesting, the burnout. I imagine it's from system to system. Once you finally learn one, you're on to the next one that's new and great and amazing in all the different ways. If I feel that way with our small systems, I can't imagine you guys. And I know that I've been sneaking back and forth, but I'm going to mix it up right now, especially because I'm interested in what Shannon has to say to this question. Um, as you guys are growing, and for background for everybody, I am a child of El Dorado County, so I am very familiar with the exponential growth that is currently happening up there. As you guys are growing, where are you guys feeling the most pressure in your workforce? Are there hard roles that are really hard roles to retain?
Yeah, I think some of our retention challenges do, like I mentioned previously, come from those patient service reps, front desk staff, and not necessarily that they're leaving Marshall, but they're also using that right as a career growth opportunity, which
Mhm.
is really great. So those continue to be high demand for us. I think the harder to fill ones are more of those specialist roles. So if we're talking about the administrative side, your analyst positions, your rev cycle positions, and even more niche items like positions like a grant writer, for example. And so those ones are harder to fill. I would say a skills gap if I went back to college, having those computer skills like Excel, Power BI, just showing that I have those that knowledge to build upon would go a really long way.
Yeah, it makes a lot of sense. And I'm curious, and I'll ask all the panelists because I'm curious for everybody on this response. But do you find that's different with younger participants that are coming in, maybe some that are considered more digital natives, or is it an equal skills gap across the board?
Uh, I wouldn't say it's equal across the board, but also, so in El Dorado County, some of you may know, like probably a quarter of our county is retirement age. So that's a big part of our patient population. So some of our staff also have to have the heart of a teacher, right? To help
Mhm.
some of our patients with telehealth and becoming comfortable with e-messages. So the competency for us to have that and then to be able to share it goes leaps and bounds, especially for our frontline staff.
That makes so much sense. Thank you for sharing that. And I imagine it's also a limitation on patients being able to access some of those new technologies too. I'm curious, Brandon, if you have any thoughts on like where the pressure is really feeling it in the workforce and skills gaps along that.
Yeah, I think for CCHCS, obviously when you look at, some of our clinical roles like RNs and LVNs, those are our most difficult positions to fill. And I think a lot of it, just kind of goes back to some of the previous questions and really gets into, not only the lack of awareness of, working within correctional healthcare, but then even taking it a step further and there's often a lack of understanding of the state's hiring process. And so a lot of times, we'll speak to a lot of candidates that are interested in working with us, but then, gets to a point where they start going through the state application process. And it is a rather long process. It is a merit-based process. On average, our time to fill is, 3 to 4 months for one position. And so, a lot of times we'll lose really good candidates because they don't want to wait around for that 3 to 4 month period. And it's understandable, but being that merit-based system and giving everyone the opportunity to apply really does hinder us in certain aspects. And then, just in terms of like where we're feeling the most pressure and everything else, a lot of it is, just our competition with the private sector. And a lot of times, just like I mentioned, with kind of gearing up our college outreach, a lot of, recent college graduates, they get hung up on, oh, I need to work in the private sector because my salary is going to be higher. but they don't take into account the total compensation and looking at, the benefits and the pension and the retirement, all of that. And so they just see the higher salary from the private sector that the state is, again, a little limited and can't really compete. But the total compensation is where we kind of make it up on the back end. And so, certain things like that really sometimes put us at a disadvantage.
Yeah, that makes sense. And I know at least once I heard hit 30, I started caring a little bit more about pensions and healthcare.
Yeah.
So I imagine that that's one of those things. And I know that the state has done or is attempting to do quite a bit of work around demystifying applying for jobs. Is that
Mhm.
something that you guys have taken on at CCHCS? Is that right?
Yeah, so that is something, we've started hosting a monthly virtual information session. Shameless plug, but they're all on our recruitment's webpage. You can Google that. So in those information sessions, we're trying to get around, demystifying the process and things like that. One thing that CCHCS does that not a lot of other state departments do, we've actually had several other departments come out and audit and kind of monitor some of our we call them our hiring events. But we're one of the few state agencies that typically about 4 to 5 times a year, we will go out and do a 1 day hiring event where it is a all-inclusive 1 day. We've got computers set up so you can come out, apply for your CalCareers account, take the exam, apply for the open vacancies, be interviewed, potentially be offered a job on the spot, go through your live scanning. It is a full day thing. But I know last year we had our institution in Stockton. In 2 days, we had over 600 people come through and we made over 350 job offers. So it's one thing that we're trying to kind of break away from the traditional norm of that state hiring process with some of these, 1 day hiring events that's really helping increase our awareness as well.
Yeah, and that 1 day hiring event sounds amazing to me, especially when I was looking for a job. So let's help uplift that. I did my own Googling while you were talking, so I think I might have dropped the link in the chat. But
Beautiful.
feel free to correct if I'm wrong.
Nope, that's
And
perfect.
awesome, perfect. Well, I would actually really be interested in maybe passing this back over to Sierra and seeing if there are any positions that you're feeling a lot of pressure in with right now in your force.
Yeah, thank you, Liz. I think so. I did a review of like our jobs and what's been open. We're seeing these for patient access reps, billing specialists, and then some of our interpreters have been open for a little bit more than 6 months. The interpreters can just be hard to fill depending on the language that we're sourcing for. But I think for these, they really, you need to be fast-paced, detail-oriented, and highly customer facing. And that we're seeing a skills gap. Um, we also, I think about challenges for the candidates, right? We see challenges with them not always highlighting the correct skill set on the resume or application for the role that they're applying for, which can make it hard to match them up with the skills and minimum requirements for our job. And then lastly, really retention around administrative roles. I think just because they're so high pressured, often our entry level to our organization and people move to other pathways. We have so many opportunities at UC Davis. We also have done a lot of work to demystify the process. I was going to talk a bit about that, Brandon. I think the 1 day event is awesome. I'm going to drop a couple of links of things that we've created. So we do career chats where internals, externals, can meet with our outreach team and our coordinators and kind of demystify the process. You can get resume help. We do mock interviews really to help where you're at in the process. And we also have a You Belong Here job series for people to come in person and meet us. So I'll drop both of those links in there for anybody who's interested, and please share it.
Perfect. And that's interesting. So when you're talking about burnout from earlier, and just to needle on this a little bit, Sierra, is that do you normally see people just move into a different sector within UC Davis, or are they moving completely out of the admin?
We do see a lot of internal movement. I would say it's probably about 70% of our hiring is internal. Part of that is also because we're highly unionized, right? And
Mhm.
especially like our nursing contracts require us to only consider internals before we can look at externals. So we do. I think there's a lot of career pathways. There's a lot of internal training programs you can take. And we even see like some changeover from like clinical over to admin because we have some pretty good admin boot camps for folks to learn some skills. So I think, any role, there's probably going to be things there that you don't like to do, but having healthy ways to kind of deal with that and move through it. And we can see burnout at any level. But I do see it the most with our admin roles. And I think it's really like just the dynamic time that we're in where, we face our own challenges. And so I do think that they feel it the most. I started here as an admin, so I feel like I can see it. I used to support our now CEO. So it is really busy and you're always kind of tied to what they need and at the computer and not always having the opportunity to take a breath and take a step back because sometimes the day just doesn't allow it.
Yeah, I completely understand. I used to manage a Starbucks back in the day, and we
Mm.
used to lose people to healthcare admin all the time. So I understand the type of person that really thrives in that role. And I do apologize to Shannon quickly, just because I promised her I would drop some links in the chat about Marshall Hospital's recruitment and some of the cool stuff that they're doing. So that's what you're going to see in the chat right now. Thank you so much, Sierra, for that. And Elisa, we can round it out with you. Are there any positions that you are feeling a lot of pressure in, skills gaps when you're looking at those?
For us, our hard to fills are really right now allied health positions. So diagnostic imaging, rad techs, x-ray techs, sonographers are really hard for us. Speech therapists, physical therapists, occupational therapists, rehab therapists, so respiratory care, those are really the hardest to fill in certain areas of Sutter Health. So that's very challenging for us. So we're always excited to see who we partner with, like Gurnick, and have new grads to bring them in and kind of get them started, like maybe in a per diem or short hour position, just so they get their foot in the door and get that experience. And then, some of our positions are unionized, so, they have to go by seniority, just to get your foot in the door those are our challenging positions that we do have.
Yeah, getting the foot in the door. I imagine some of those admin roles might be a nice one to try to get that foot in the door and then open up wider to the Sutter Health system. So that's also a
Apps.
nice way to.
Yeah, absolutely. And I talk to people all the time. Hey, I'm trying to get someone in. They're interested in the job, and of course, everybody wants a full-time job, a day shift, Monday through Friday. But we start posting internally first to see, and then somebody that was per diem or short hour can apply. They have the skills, they know the systems, and they have that opportunity to move up. And so, yeah, just I really encourage people to just try to look for something. Um, that might not be your ideal position just to get your foot in the door and learn those skills, and then a part-time or full-time day shift can come up.
Awesome. Well, thank you for that. Just being able to leverage your network to be able to open that door is so
Yeah.
helpful when applying to those future positions. And as we're moving on to question 4, I might keep it on you, Elisa, because I know that we've heard a lot today about AI and technology and how roles are evolving, regulations and models of care and the such. Can you talk to a little bit about how maybe some of those changes are showing up in your organization? And what skills are being impacted?
Currently, right now, Sutter Health is just exploring AI, and what we can use it. We just use it right now for as a chat bot, but we're concerned about government regulations and compliance. So we are exploring it, but no position, has been taken because of AI at this time. We're exploring it at this time.
Yeah, that makes sense, especially as a hospital system to maybe be a little
Yes.
cautious.
Mm-hmm.
Uh,
Exactly.
Keeping everyone on their toes. Sierra, do you have any thoughts on that?
I would say I definitely agree with Elisa. We are probably very conservative with how we're utilizing and what we're allowing to use AI for. One area we have started using it is for our notes for our doctors. UC Davis has never really adopted or widely used scribes, so we haven't taken not a single position away. We're still very people focused, and we are looking for ways to support our workforce and streamline and enhance processes, not replace people. Um, So I also want to confirm we're not using it in any part of the AI. The recruitment life cycle, we don't use AI at all. We still have humans screening every application, reaching out to candidates. We don't have any automation built through the recruitment process, and I don't see it coming. I just watched a presentation from our new president yesterday, who's still very people focused and just looking to see how we can enhance our work versus replace any of the workforce.
Awesome. Yeah, I love that. Enhance work, not
Hmm.
replace work. Make it easier to do some of those more repetitive tasks. And then I know, Shannon, that you were actually on the previous panel for us on AI, so this might feel a little bit repetitive coming from me, from Valley Vision to speak about, but I would love to hear your thoughts on this because I know you guys are a little bit more smaller, a little bit more nimble
Yeah.
up in there.
Yeah, we recently created an AI governance committee about a year ago to make sure we have eyes on all the projects that might be coming up or at least might be getting researched. And similar to Elisa Sierra, limited implementation. We do have AI Scribe for our docs, and so far they are loving that. It's my understanding. And so really a cautious approach between being in healthcare and then being a California state employer. We are tiptoeing in that direction. Um, so it's coming, but we're very slow, I think,
Yeah.
cautious.
That makes sense, especially around newer technologies. And then Brandon, felt like a really good segue. Thank you so much, Shannon. As not to say that the state maybe might be infamous for being a little bit slower when it comes to technologies. I don't want to say that, but I am curious to see what you guys are experiencing over there.
I think that's pretty spot on, though, to be honest. We have taken a very, conservative and slower approach. To be honest, even with the fact, with utilizing platforms like Handshake for some of our college outreach, we even had to bring in the California Department of Information Technology, to really kind of go over and review the contract with Handshake, just because there were certain components of AI integrated within Handshake. And so, yeah, really just taking more of a detailed and cautious approach, um, as we are, a state entity. So we haven't really gotten too much into IT. Even to the point on all of our laptops, all AI websites are blocked. So it's nothing that we can even utilize to for our doctors within the correctional settings to take notes or anything like that either.
They said no temptation whatsoever. They took that away.
Exactly.
It's funny. My partner works in IT, so I'm familiar with being blocked from something. So that's a familiar moment for me. Well, thank you so much, Brandon. I really appreciate that. And I think I might just keep it on you as we move into this last question before we open it up to the larger audience. I know there's been a lot of questions in the chat, so I'm really excited to dig deep into those. But if we do get this right, and this is like a little bit of an easier spitball idealistic question. But if we get this right and we get a really great admin health pipeline going, what skills would an ideal candidate coming out of a community college program have? Where would be the biggest opportunity for like stronger collaborations within CCHCS? And I'm trying to make sure I get that acronym right, and the community college systems.
Yeah, I think, when we look at like our ideal candidate skills, really strong communication, professionalism, reliability, accountability, a lot of those basics. Because a lot of like when I go out to some of these different speaking engagements at the universities, a lot of what we preach, like I mentioned, is we are an organization that is more welcoming to new grads. And so, being able to hold yourself accountable, be reliable, come in, we can train you on the job aspects, but some of those other, key characteristics and components like the accountability, the reliability, that stuff, is kind of what we're looking for. And then at the end of the day, the other thing we kind of preach is, finding your why, right? So, um, combining your passion with our organization to really, make an impact on the needs of the incarcerated population. really is kind of the underlying issue and or not issue, but skill that we're looking for.
Yeah, that makes so much sense. And thank you for that. I love the idea of just being open to new graduates and really trying to help uplift that next generation of students and workers. And I know that's also something to not to shift over, but I know that's also something that Marshall does. As a new graduate, you guys are really open to having new people. So I'm curious what that would look like for you, Shannon, from Marshall's point of view. Just getting it right, making sure that next candidate coming to you is looks ideal.
Yeah, so we do allow learning opportunities for new grads, etc. And I think for administrative healthcare careers in particular, um, most helpful if you came out of your educational learning and joined the workforce with some foundational knowledge, for example, of how rev cycle in healthcare works, how value-based care works, only to enlighten your understanding of the bigger picture of how the business operates. And to Brandon's point, the focus on the patient and understanding the downstream impact of how your service impacts that patient, I think would be really critical for anybody to be successful in any healthcare role. And another thing to keep in mind, we mentioned we have a high school class here listening with us today. I know Marshall and probably all of these employers also have educational opportunities for current employees. So you could start here perhaps as, a patient registration rep, and then we could sponsor and have some tuition reimbursement programs if you go into healthcare fields, as most employers do. So that also speaks to what I believe Lisa was mentioning earlier, that you could start with the goal of ending up somewhere else.
Yeah, exactly. That's exactly what I was just thinking. Speaking to Lisa's point of getting that foot in the door and maybe being able to rely on your employer to pay for some of that education. That's kind of the dream, at least for me. So maybe I can go ahead and pass it to Elisa since we're already kind of talking about her and see if there's any thoughts that she has on what an ideal candidate would look like and what partnership with the community college could look like.
Yeah, I know we do partnership with a lot of schools and other training programs like Gurnick. I'm not going to list them all, but our ideal candidate is a balance of hard skills and soft skills. So hard skills is getting that education, making sure you can do that job successfully for that patient or whoever you're dealing with. And then the soft skills are really something we're honing on and looking for in a person when we're interviewing them. The communication skills, critical thinking, being able to adapt, able to adapt to stuff, be a team player, have leadership skills, and then time management skills. So I know those things we really look for that are, along with the hard skills.
Yeah, it makes so much sense, especially, I mean, it's true for every job, but when we were talking about administrative roles and people scheduling, I
Hmm.
imagine time management comes into it's very key and important. And I'm going to actually go ahead and drop the Los Rios and Sutter Health event that's going to be happening. I tell you, what does Ideal Community College collaboration looks like? And we already are featuring it. So excited to have that. Thank you, Elisa. And Sierra, I started with you. It felt right to end on you. I don't know. So working together, what does that look like for you? A new, brand new hire, what's a good one for you? And then also that collaboration with community college.
Yeah, thank you. So all the soft skills everyone listened. I do think it's really imperative to have foundation in both the soft and technical skills, not necessarily licensure, but understanding the big picture. On soft skills, a couple that I had prepared that I didn't hear listed was attention to detail, and then communication, like honing in that also includes all your written correspondence and responding, because that's showing your reliability and follow up and follow through. Um, my younger team members wanted me to remind you can't ghost your recruiter, your future boss. We see that a lot. You might be surprised. They're just like, oh, okay, this is not the right job for me. And they leave and we never hear anything after that. So really just wanted to say that out loud. Um, we have really recently focused on our pathway programs, Gurnick and others as well. We always want to create more pathways. So if there's folks who want to do that, You can reach out to me. I'll make sure my contact information makes it to chat. We're always looking for internships. We have a lot of external opportunities, residency programs, um, but also reminding like our new applicants coming in, it doesn't have to be paid experience to count, right? If you've gone through unpaid internships, simulations, other just projects and things, you can gain skills from those to highlight to be an ideal candidate. But we're always looking to expand on our pathways and create ways for folks to come in at all levels. So I'm really excited to see if any new partnerships come out of today's panel.
Excited to see that too. That would be awesome. Yeah, I really like the idea of don't burn bridges, especially when you're starting to apply to places. You never know who might be the person that could get you that next job. So important to call out, especially because when we're talking about soft skills, they might not be the direct thing that gets you hired for a job, but they will maybe get you let go from a job. So important. Thank you so much for our panelists' time today. I really appreciate it. We're ending quite early, and I think that speaks to our administrative folks on today. They're all very, very to the point and make sure they get all their points in, and I love it. I'm excited for it, and it allows us more time for questions in the chat. And I know I had a few. Caitlin, do you want to help me
Yeah.
parse through some of these?
I can jump in there. And before my first question, I'll just say I'm laughing as Liz is mentioning burning bridges, but a few folks have been really excited to get our panelists' contact information. That being said, I also want to protect folks' email inboxes. So I see some panelists have dropped that in the chat. If you all are comfortable with that, please feel free to do so. Valley Vision can also be a liaison connecting folks between that too. So just plugging that in there. And I'd have a number of questions from the chat. Some of these have been answered in our discussion, but I'll just on that note of ghosting, I think that's interesting. And pulling a question from Daniel here, are there like some of the top reasons that job seekers might get rejected in the hiring process? Is there something common that you all are seeing within that? I'd be curious if there's anything top of mind for y'all.
I can start us off. I can share for UC Davis when we're posting our positions, we do post our minimum and our preferred qualifications. We screen every hard skill that's listed. So if it's there listed as a requirement, not a knowledge skill or ability, but a hard skill, it gets screened. So if you're not highlighting that as a skill that you have or experience that you have, you will get rejected. So I know that we're really stern about that and just really being in the union environment. We don't deviate from that practice.
Thank you.
Yeah, and just jumping in to piggyback off of that, like to Sierra's point, with the state application process, regardless of which department you're applying through, every department you apply through Cal Careers. On that Cal Careers job posting, it's going to outline what the requirements for that position are. But if you scroll to the bottom, it will also list what the required documents are that must be uploaded. For several state positions, it will require what's called an SOQ, a statement of qualification. And I cannot tell you how many times a candidate was rejected because an SOQ was required, but they didn't submit the SOQ with their application. And so just again, kind of going back to those skills and, honing in on that attention to detail, really making sure you read through the entire job posting clearly.
Thank you so much. And I see just quick, I know you, Daniel, you had a couple questions in there, and I want to maybe give this opportunity to.
Oh, sorry, Caitlin. I just think Shannon had a response to that as
Oh,
well.
absolutely. My apologies.
Yeah, just real quick, I agree, and especially what Sierra said, the requirements are kind of pretty black and white as far as that goes. But also sometimes if either you wait too long to apply and it's a high demand job, then it closes pretty quickly. And just a mention, since we have some folks that are entering the job market, how you show up at the interview and or how you treat others throughout the onboarding process does reflect, and there have been times that that might have been a deciding factor as well. So mock interviews with your family or friends or through some of the services in the community really goes a long way.
Thank you so much. I was going to note, Daniel, I see some of your questions in the chat. I just wanted to give you an opportunity to jump in verbally if there's anything you want to uplift there.
No, thank you so much. That was extremely helpful. It's just helpful to think about what are the common mistakes that potentially applicants are making. That could be really helpful for workforce development programs just to, and it also just really about the enablers too, because something that I think about as someone who's hired myself is that you may have lots of competitive applicants. Again, I don't really know the situation, but yes, you could ding people, but like what are the things that like get people hired, especially if you're first time career seeker? I don't want to launch into another question because I feel bad that I've asked so many. So I want to
No, we welcome it if you have one, no
defer
worries.
to others in the conversation. So please feel free to skip any of my questions. But it's just sparking a lot of thoughts as someone who has applied, talking to a lot of workforce development programs and also have hired. It's just interesting to think about how we can use this information to frame and guide the next generation, especially early career seekers that are basically finding their rung of the ladder disappearing underneath them. I think this is all super valuable. So thank you.
Yeah, absolutely. Thanks for your excellent questions there. And I think that covers the questions that have been brought up in the chat, but I want to open up the floor for folks to.
I'm seeing one from Susan, and it says, how is the new hybrid slash remote workforce being addressed in recruiting for administrations? And I'm curious if there's anybody on the panel that would like to hop in first on that.
I can speak for us. Being a smaller facility, obviously certain jobs don't lend themselves to being remote, but ever since COVID, we've really tried to take a more liberal approach with that. So if your job can be done remotely, we do try to work with our hiring managers to allow either a hybrid option or, for example, I think most of our billers and rev cycle folks are remote. And we've even expanded and have a few out-of-state workers, which is new for us over the last few years, but has really brought us some talented employees as well. So we're pretty open to it.
Yeah, and I think for us, it's a lot of the same. So more of our clinical roles, obviously due to the hands-on nature of the work environment, are going to be in person. But for more of our administrative positions, for myself, I work in human resources. So being a State Department, we do have a hybrid workforce. Each department kind of, you know, runs their own hybrid model. For CCHCS, we are 2 days in office, 3 days remote. And then with that, the only kind of caveat for, us obviously being a state employer is you must reside within the state of California. And so we do get a couple of loopholes where we have some individuals along, maybe the Oregon border or the Arizona border where they do live in those other states, but they are not permitted to telework from those states. So they would have to come into the office, which, some of those institutions, it's maybe like a 5 or 10 minute drive from the border. So it's not terrible. But you must reside within the state of California and work within the state of California.
Same with Sutter. We do have hybrid positions too, where people can work from home for a few days and then come into the office. Um, and you have to live in California for most of our positions, especially through our foundations that we have here. You have to work from California. So we do have that too.
At UC Davis, I would say hybrid is more common for like our HR teams. A lot of those teams went fully remote with COVID, and we have seen like a big shift that they're all remote. Like my team is all hybrid now. We changed to hybrid where for like 4 years we were fully remote. We do have some niche positions that we allow for out of state, but we post them as fully remote. No physical access, meaning they're never coming on site. They are typically like super highly specialized, like maybe a specific interpreter if we can't find one in the state. I think for like IT, some of our engineer and roles that are really just looking at databases and not needing to be on site. But most of I would say 95% of our positions are completely on site in person, maybe 4% hybrid with 1% being out of state. We're really focused in having folks come in, but everybody who works at the hospital is there 100% of the time.
Thank you. And I do think that might be the end of the questions. But if there are any remaining, please feel free to drop them in the chat. And then, Daniel, I know that I appreciate you so much taking all of these amazing notes. I do also want to let you know that we develop reports after everything that's said, and a keynote and all those things will be sent out along with the recording of this event and the slide deck so everyone can go back and review it. I know sometimes we get to see that labor market data and then we want to revisit it in a couple of months. So just to let everyone know, everyone who's registered will receive a recording, a report, and the slide deck. And I believe I can pass it back over to Caitlin at this point.
Yeah, absolutely. And I'll drop a link in the chat here. This is a page that has all of our past regional industry advisories for healthcare. You can also see the developing a ready workforce page there, which is all industry sectors. So oh yeah, Ashley, go
Oh,
ahead. We have some time for a question or two. Go ahead,
and
Ashley.
I think Ashley might be we'll see.
Hello, can you hear me?
Yes, welcome, and thanks for joining with your class, Ashley.
Yes, thank you so much. Sorry to kind of cut in there on what you were saying. I just for the panelists, I heard a common theme of the soft skills, which I understand and I would imagine is a lot easier to evaluate once you get to the interview and that part of the hiring process. But I'm curious from the panelists, how do they evaluate that on the beginning part of the application process? Some things become obvious, like attention to detail. That shows it in your application. But earlier, people mentioned willingness to learn or accountability and things like that. So I'm not, in my experience, that's a little difficult to prove on, say, a resume or an application. So I'm curious from them, how are they able to identify those things? And if they aren't able to do that, what are the pre-screening things that the applicants need to get past and through to, obviously show that they're qualified so they can get onto that point to stand out as somebody who has soft skills?
I would say for UC Davis, it is evaluated through the interview process. But for me, that starts at like the phone screens with the recruiters, right? Your communication, attention to detail also shows up in your application and resume. Do you have misspellings that, typically means you weren't double checking your work? But we're just looking at those hard skills for screening, and then we route everyone over to the department. So sometimes they may not get an interview because somebody maybe had all the preferred qualifications and you only have the minimum qualifications. We are seeing really high applicant pools. And so, we may route over 50 applicants to a department, but if they only have one position, we're definitely going to want to scale that down just to make it more easier to fill the role. So the top candidates would get the consideration for the interview.
I, and Ashley, to tack onto that, and similar to what Susan put in the chat and Sarah mentioned earlier, but especially if you don't have your degree yet or if you're out of high school, I think on your resume highlighting activities that you might have done that lend themselves to developing those soft skills. So even if it's something like you've been in 4-H all 4 years, that speaks to accountability and responsibility, right? If you've had some volunteer work, if you've taken some even Coursera courses that are free for whatever position that might build on that education. And so to me, that shows that you're motivated, you're interested in learning, and you're ready to kind of hit the floor running. So those are some really great ways I think an applicant who might not have their work experience yet or the degree yet could really show, and the recruiter is going to look at that and take that as valuable.
Yeah, and also taking some courses on LinkedIn. There's a lot of places where you can get certifications, and there's so much there that you can learn. Putting that on your resume is also helpful too.
Yeah, and I think for the state too, a lot of, what the other panel members all mentioned, obviously all that applies to us as well, being able to highlight some of those soft skills on your resume. We kind of also dig in a little bit more, through our interview process. They're all going to be all of our interviews are going to be a panel based, asking a series of questions that's going to rate you. And within those ratings, a lot of times we're kind of trying to key in on some of the different soft skills and things like that that you might mention in your interview question. And so a lot of ours, yeah, it is going to be determined through the interview process. But that being said, our HR team does go through and review all of the applications to kind of go through and rate, who's going to be the higher applicant based on, the key criteria from the job posting, as well as some of the technical skills and soft skills that have been placed on their resume.
Thank you so much. And I know we have one more question. Daniel, I'll pass the mic over to you.
Yeah, thank you again for the space and just amazing insights. This is just more of a synthetic question for the employers because, again, I'm trying to think about this from the perspective of a new early career job seeker. And I'd love to just, I know there's going to be notes, but this is just for my own learning to kind of hone in. I'm curious if the employers would add anything to this initial list of things that they think would make the biggest impact for a new early career job seeker. So, like some of the things that I've heard so far is potentially the targeting of persistently unfilled roles. I know some of those were mentioned. Overlooked employers. I really love that idea with the state. I wish I considered the state once I graduate from college. I think that's a really interesting point. I love the point about part-time per diem jobs and pathway programs. I don't even know what pathway programs are, but just this idea of like getting that on the radar if you're a new early job seeker and being really open to per diem jobs. I could potentially see that being possible when you're in school still to do those per diem jobs, and you might have some more flexibility and start building early career experience. And I think there are a lot of really great tactical things around the application process, like hard skill requirements and stuff like that. But I'm just curious if there would just in the interest of synthetic, and it's just so cool to have all these employers here in the same screen. Like, would there be anything you would add to that list for a new first time job seeker? You might just be graduating from high school or college.
Yeah,
So
Shannon added something in there because we do a lot of hiring events, virtual and in person. We post them all on LinkedIn. All of my recruiters have LinkedIn recruiter seats. And we also do Indeed hiring events to look for virtual. And we do them for all levels. We just recently did one for LVNs because we had a huge influx for the Folsom ambulatory care center that we had to do that was really successful. We do them consistently for like admin, finance roles. So just looking maybe on some of the job seeking platforms for opportunities for hiring events.
I love that. Hiring events is so critical in the sense that a lot of times just getting your face or name in the door, just meeting directly, whereas you could just be screened out really quickly from an online application process. I think there's something special with that. Thank you for sharing that.
Of course.
yeah, Daniel, and so we do a lot of community events, which I assume all the other employers do as well. So for example, if you see us at kids health fair, or recently we were at the ski clinic at Sierra and met a family member of a job seeker, and so just even that minimal amount of networking could get your name mentioned to recruitment to say, hey, did Betty Joe apply? And so for those that might not have wider networks that exist yet, those are great opportunities to at least meet some of the employees of where you're trying to get employed at. And then that might be super helpful as well.
Oh, that's interesting. Can I just make sure I understood your point there? You're saying it may not even necessarily be a recruiting event, just go somewhere that the employer might be hanging out and obviously in an authentic way, but just sort of like make yourself known. I think that's a really fascinating idea just to kind of get your name out there. Is that what you're implying?
Yeah, for us, a lot of our folks that are doing our community outreach program, whether that's our community volunteer supervisor, or if it's our cardiac rehab technician, most of the people that are doing those community events are super passionate about what they do. So when they
Right.
meet somebody off the street, that it displays to them they're also super passionate about maybe getting onboarded. They'll usually remember their name. They might offer it like, hey, let me connect you with the recruiter directly. So there is some informal networking that could be had there.
I love that idea. Thank you.
Thank you. Any thoughts on that from our other panel members?
I was thinking what Shannon said a couple of years ago, the last year and the year before that, we would go out to a few of the River Cats games and just have a table out there and have our QR code there and just saying hi and here's some of our positions and just saying hi to the community and being out there. So it's a lot of fun. We try to do as much as we can for community events and yeah, just networking there, looking for recruiters on LinkedIn, ask them to be, to follow you or you could follow them and just seeing what we're doing out in the community. LinkedIn is also a great way to network.
Yeah, fantastic. Thank you.
Yeah, and I was going to mention LinkedIn as well. We try to post a lot of our job postings, information about our department on LinkedIn, but very similar to what everyone else, all the other panelists were mentioning. We really do, like I mentioned, I oversee the community outreach team, and so getting out at some of these events, my staff is very passionate, and so having our QR code where people can come up and a lot of times, like we mentioned, there's that stigma or, working for the state or where they see, the word corrections in our name and they don't necessarily associate us with the healthcare aspect of it. They think, oh, I don't want to work, in corrections. I don't want to be a correctional officer. And so trying to break down, some of the stigma with that. So we're really out there in the community trying to make that known who we are and what we do. So, yeah, definitely come up and approach us and, happy to, provide any information we can. So,
Thank you.
I just wanted to quickly add
Oh,
that I,
sorry,
oh, oh,
Daniel. I'm gonna jump in there because I want to take one last question from Susan, and then our team has to keep rolling. But
perfect.
please feel free to
Absolutely.
drop any questions in the chat. And I also want to call out. I see a Pania Yang, senior recruiter from Dignity Health, is here too. Thanks for joining us, Pania. Please feel free to drop in the chat. But we'll do one last question from Susan, and then we will move forward here. But thank you, Susan. Take it away.
Thanks, Caitlin. So, panelists, I work in education, academia, allied health, nursing. I've been on the program manager side, coordinator side. We still run into huge problems with clinical sites. And I guess, competition. I'm hearing a lot of private schools, especially on the rad side, Gurnick being one. Um, Additionally, I would know just about the clinical side. I know that's a larger issue, PLAs and contracts and things like that. But talking about community involvement, I noticed that after COVID, the volunteer programs still remain very shut for a lot of these pathway students or people interested in that. And I'm wondering if the panelists here in your facilities are opening up those volunteer programs. Literally, rad students that I have every year, every semester, they try to get these shadowing hours, and it's almost impossible for them to get in, even as a volunteer, much less as an official shadowing capability not associated with the program. So how are each of the individual facilities, corrections? I started out there in healthcare, so I know that's a little more difficult with clearances and security, bringing in volunteers and clinicals. But the other major sites, how are you opening up both clinical rotations and, more importantly, the volunteer work? So it's not just meeting out in the community, but it's allowing them to come in and have that exposure and to meet those people.
yeah, and Susan, I think like you just mentioned, the big thing for us is obviously going to be the clearance, and so trying to bring in volunteers, and different pieces like that, it does get a little difficult. We are in the process of trying to start up some more, externships. Medical assistance has been another one of our hard to fill positions. And a lot of that is, some of our institutions might be a little more remote and there aren't any colleges within 50 to 100-mile radius of that institution that have an MA program. And so really trying to find ways of opening up externships and working in partnership with the schools to be able to come in and provide maybe a support staff to work alongside our clinical professionals. So there are certain things like that that we're trying to open up to really, kind of generate more interest. Yeah, just the correctional piece in terms of, security and background checks, tend to kind of get in our way a lot.
Yeah, Susan, what you said is true, that was what happened at Marshall with COVID, is our community volunteer program did pause for quite some time, and it took longer than we even anticipated to get it ramped back up. It is ramped back up. I think the only portion that we're still working on is in labor and delivery. but we have focused over the last year of trying to increase our capacity for shadowing and student internships, for example. I think our problem is more of limitation of resources and space. Because we're a smaller facility, the bandwidth to bring on a lot of those folks at the same time is limited. So we actually just instituted some software to help us with students with my clinical exchange. And so we are trying to build that bandwidth and also reduce the restrictions that students have there, or the red tape that students have to go through to come spend some time with us.
Amazing. Thank you guys so much for all of the questions from our panelists, and thank you so much to our panelists for your time. I know this was a lot of questions and a lot of you guys talking, so just really appreciate it. And yeah, again, we'll send out any notes. Happy to hear anything that you guys might want to pass out, and we'll send out all of the links that our employers dropped in the chat too. With that, I think I can hand it back to Caitlin to
Thank
go
you.
over some handshake, which Brandon mentioned earlier. So that was a good little tee up for us, Brandon.
Yeah, perfect plug. Well, we'll jump into our next slide here, but just want to talk a little bit about Handshake at Los Rios and really, confirming that connection between our colleges and employers and kind of the greater ecosystem. If you're unfamiliar with it, Handshake is a platform utilized within the Los Rios system to connect employers and students. And I'll jump into our next slide here and talk a little bit more about what it does. Employers can post job and internships there, engage directly with students. It's reminiscent in some ways of LinkedIn, but I find it's a little bit more direct, and you're not weeding through about 150 other outdated job posts as you might on LinkedIn. There's also opportunity to attend career fairs and help to build up your company's brand there. So it won't take up too much time, but wanted to plug that. And I think we have just one more slide touching on Handshake here. Folks can use this to grow your networks. There's over 6,000 local employers who are on Handshake for our Los Rios system, and 34 California departments who use it locally. And if folks are interested in that, you can visit joinhandshake.com and select employers and get all teed up there. There's also some additional information on local career centers or work experience and internship programs that you can access through Handshake. But we'll move into our next slide. Finally, here, I want to drop in the chat. We have as most events do, a post-event survey that we want to share with you. But if you see myself, Liz, and our colleague D'Angelo Andrews on this call, all three of us will read every single survey response that we get in here. And additionally, we also have a question plugging, this advisory was on administrative healthcare careers. If there are other topics you're interested in, could be in healthcare, could be across a variety of sectors, we want to hear them. So that's an opportunity for you all to share that with us. We often connect with folks who attend these to be on future planning committees and get that information from you all. So I've plugged that in the chat. And also, it gives us an opportunity to let us know how we did and some room for improvement for the future. I know we have a lot of some teachers and education folks on the call, and you know how important that constructive criticism can be as well. But just really appreciate also, I want to harken back to our employers. We know that you all are very busy folks who've taken 2 hours out of your Friday afternoon to come join us. And in particular, I'll say I think our healthcare system is burdened right now. You all have a lot going on, and we felt that in our process of recruiting folks. So I just really want to heartily and genuinely say thank you for taking the time out of your day to come and join us. It's our privilege and our honor to be able to bring folks together and share this information. And it's exciting to see the processes and things that come out of it, as we've touched on today. So just want to say a huge thank you to our employers. And with that, I'll go on to our very last slide here. Mine and Liz's contact information is here below. You all are absolutely welcome to reach out to us. We look forward to connecting with folks who've attended, employers, etc., to work together for the future. But with that being said, I will give you all approximately 1 minute back. We were nervous that we would end early today, but we had so much fantastic feedback from you all in the audience. Never too many questions. That's exactly what we're here for. And I really look forward to connecting with some of you offline. But want to say thank you again to the folks who helped plan this advisory, and we'll let you get back to your Friday afternoon. Thanks for joining us. Have a good one.
Thanks for bringing us together.
Awesome. Thanks, y'all.
Thank you.
Thank you, everyone.